Hey there, welcome back to the Exceptionality Series. Today, we're talking about developmental disability. Within the exceptionalities, there's the intellectual category, and a subcategory of that is developmental disabilities. And I found it a challenge to find an appropriate case to discuss. And I realized that most of these cases are filtered out prior to entering kindergarten. So the child might have some malformations at birth that lead to genetic testing, or they may not meet their milestones at their well baby visits. And all of this gets sorted out, and the children get followed quite closely. And so all of those situations lead to kids coming into kindergarten with diagnoses of and different genetic disorders, so Fragile X, fetal alcohol would hopefully get caught prior to entering school. Autism might be diagnosed prior to entering school. Down syndrome, of course. So all of these are comorbid with the developmental disability, which is now called intellectual disability category. And it just increases the chances that that's present. So I realized when I diagnose a developmental disability later, it's often because the child has some strength of either strength of character or a particular ability that has helped them kind of fly under the radar. But I was able to find a few good cases, and I think I compiled something that makes sense. So I will try to run a real feedback meeting for Claudette Charming, who is a 9-year-old girl whose assessment leads to a diagnosis of developmental disability. Okay, so thank you for coming today. I'm going to go over the report for Claudette's assessment. When you leave here today, you'll leave with a copy of this report that we'll go over in depth, and I'll give you a chance to answer questions. And definitely anyone out there, please feel free to stop and ask questions along the way if you have any. This is Claudette's first assessment. She's 9, but I don't think it'll be her last. So you should know what to expect every time. It'll always look really similar. So you have her identifying information at the front page, reason for referral. Then I list the different tests that we complete. Then all the background information is all that information you provided to me on the background form, any conversations we had with regard to her history, and also all of the OSR information. So I've taken the time to look through all of that and to speak to her teachers. The next session is behavioral observation. So that's how Claudette was with me, just to get a sense of the different things that are impacting her learning. The bulk of the report are results, and so we'll definitely talk about that today, a little bit less than normal. So that includes intellectual ability, adaptive functionings, and academic abilities. Then there's a summary and recommendations. And so that's what you're going to get as soon as we're done and you've asked all the questions that you want. So let me just get started here. So Claudette was referred because she's been struggling to learn the concepts since she started school. She's not making like true friendships. She seems to be taken care of by the other kids, according to the teacher. She definitely follows the group, but her mom is concerned that she's more nervous at school, and she actually wonders if Claudette might have autism because she really does agree with the school that the friendships are not coming along. And she also has a really odd memory for things. So she sticks to the same topic, and she can be really repetitive once she gets on a particular topic. So that's kind of why I got involved. From the information that you gave me, Mom, we see that Claudette was generally slow to develop. So, I mean, when you present her development, I see how you really appreciated her and kind of let her be her own self and grow as you would have wanted her, and you accepted her the way she was. But when we look at the data, she definitely was later at walking. So she only walked at 19 months of age. Her speech was delayed, and so she received support through speech services. She also received community support for her motor skills because that was an issue. She definitely continued to struggle with toileting till the middle of grade 1. And I did love hearing that you had a solution for that. So you had a change of clothes for her at school, and there was a system to quickly get her cleaned up when that happened. and that she has since learned and is toileting independently. I think that just really is protective of her self-esteem, and so I'm really like congratulate you on that. You did report though more recently that she's whiny and nervous at school, and you think that this happens when she doesn't understand what she's supposed to be doing or if she's struggling with her motor skills. So, and when that happens more recently, now she's starting to lash out and having these behaviors that you can't explain, some aggression. She has been seen by a pediatrician and she doesn't have ADHD, and you brought her to a social skills group for her lashing out, and they called that anxiety. And that didn't seem to have much of an impact, but she went anyway. That's kind of the information that I got. At school, I found that when she started kindergarten, I was happy, so happy to see the Brigades, because that's some proof early on that there were some difficulties there. So she definitely fell below cutoff, which tells us that the concerns have been there all along. She did start off in the immersion program really briefly for just a couple months, and they everyone just kind of decided that wasn't for her, and so they moved her right out. And since then, she's participated in reading programs. She's gone to resource for reading intervention. And on her most recent academic assessment, the resource teacher found that all of her academics continue to be in the very low range. So right now she's withdrawn 3 times per week for about 40 minutes. She's in grade 4 now. And from what everyone is saying now, she's starting to avoid school. So she's missing a lot. She's starting to have some social problems at school that weren't that evident before. And she's getting upset at school to the point of making herself sick. The concern from the teacher is that she doesn't talk to people about what's bothering her. And the program level is modified to a grade 2. So that's kind of the information that I gathered. So in order to figure out what's going on and to answer questions about what we should be expecting from Claudette, I use tests that are standardized and normed. I want to talk about those terms for a little bit. So standardization. So my tools are standard. So I administer the test the same way other psychologists administer it. And in that way, we have a really good sense that when I'm talking about a certain score, that psychologist can have confidence that that score is representative of the child's abilities. One thing that you have in your possession that is standard and that helps kind of understand the concept is a ruler. So if I have a ruler, and so let's say your teacher measures a locker at school to let you know what size book she can put in her locker. The teacher will measure, you have a ruler at home, you will know what she's talking about. So that is a standardized measure. The tools are also normed. So it's a little bit more complicated process to look at. So when we talk about average, how do we get to that average range? Well, for these tests, what we do is prior to using it for children where we have questions that we want to answer, we administer it to the population at large. And in that way, we can know when we ask a particular question. So if we talk about vocabulary, we might know at 9 years of age, such as a child like Claudette, how many words a typical 9-year-old can explain. And so if you look at the graph, at the bottom end, you have, like right in the middle, there's the numbers. So from 85 to 115 is about a standard score, which we didn't talk about and won't talk about. But if you just kind of slide your eyes a little bit lower, there's what we call percentile ranks. So there's the 16th to the 84th percentile. Those kids are all kind of typical. And so if your child answers as many questions as other children, then they would fall somewhere from the 16th to the 84th percentile, which is a large range. So that's what we're looking for to see if the child can profit from what's happening at school, as well as you'd expect. Now, if the child answers fewer vocabulary questions, if that's what we're looking at, then they would fall in this below average range. If they answer more, they would fall in the above average range. 1 or 2 of the kids would be very much lower than others. And that's how we determine how many gets you into that category, is that there's only a couple of them. So if you're the bottom 2 and you are able to describe 3 vocabulary words, then we say that is what's at the lower end. And the same thing happens up here where it's the superior end. So the kids here might be talented or gifted in that area. If you do take the children and line them up from the 1st all the way to the 100th, you have the 1 and 2 here that are very different than the rest of the group. Then you have from like the 3rd to the 15th that are far enough apart, and there's a big difference between them, but they're in the below average range. Then from the 16th all the way to the 84th are very hard to distinguish from one another, very similar. And the same thing happens at the other end. We're really looking to make sure that the child falls within this kind of broadly average range before we're concerned. Now, before we move to the scores, I want to talk about your concern for ASD. So autism spectrum disorder, and that's a hard thing to kind of bring forward. So I appreciate your courage in stating it. But I just want to alleviate your concern. So this is not something you need to be concerned about. With me, Claudette was cooperative and pleasant. She was very eager to complete the work. She was very polite and thoughtful. She was chatty, actually. She shared her interests freely when she wasn't in a stressful situation. We had some simple conversations back and forth, which is something you wouldn't expect to be very rewarding with a child with autism spectrum. And there actually happened to be a child tantruming outside the room, and that visibly upset her. So I saw that anxiety that you talked about, but she reacted well to being consoled. So that was really easy to kind of bring her back down. She did have some brief kind of stereotyped movements and some rocking. So I can see why that would have been a flag. But it's really important to note that the core deficit in autism is social communication. So that's not something that's observed in Claudette at all. So I do not think that autism is something we need to look at any further. And she did work hard. And so I do feel like the test results are valid. Okay, so we're going to move forward really quickly because I know you're probably very nervous about the results of this. So when I look at the results of her, I want to start with her adaptive abilities, which represent her ability to be independent at home and in the community. She falls in the 1st to the 3rd percentile, so better than 1 out of 3 children her age, but she does have a strength in her social functioning right now, with that being a little bit higher. So this does represent a delay compared to other children in her adaptive functioning. When we look at her intellectual ability, and so with I'll just orient you to the graph. So this is the same graph we saw earlier, but flipped on its side. So this is the low end, the high end. The average range is right here in the darkened area. And so you can see that her intellectual ability is substantially lower than what you would expect for a typically developing child. In fact, her ability to think and reason is actually lower than 1 out of 1,000 children her age. Okay, so right now parents would normally cry here. So I would stop and deal with that, offer tissue, empathize. I've been in a situation where I've had teachers be very uncomfortable with that. If you're uncomfortable, just take a deep breath and like you have to let it happen. It's a difficult day for parents. They will often cry, but then eventually they'll come to some relief. And a lot of them will say that it's not a surprise for them at all. So we're just kind of stating the obvious. So I'll continue by stating that we can look at the specifics next, but that these results mean, okay, so what does this mean for Claudette? So it means that she meets criteria for a diagnosis of intellectual disability, intellectual developmental disorder in some areas. And eventually parents will kind of get over that emotional piece and start asking what that means in terms of her development. So when they're ready, I would kind of re-summarize. So her adaptive abilities are low, her intellectual abilities are moderately impaired. She does have strengths in her motor processing speed, so her paper copying skills, still lower compared to other kids, but a strength for her. She also has a strength in her social ability and her ability to relate to other people, even though it seems like she's lagging there. And that's probably what has made her get by to this point. She has some ability in phonetic decoding as well. I didn't show you the academics, but everything is kind of in line with what you'd expect. given her IQ, and she's at about a grade 1, pushing to the grade 2 level. She does meet diagnostic criteria for intellectual disability, mild to moderate. So how do we deal with that? We definitely recommend identification as a child with developmental disability. She'll continue to have trouble learning at the same rate as others her age. And when I mean, I feel like that is kind of lip service and doesn't really explain the extent of it. So she's functioning now when she's 9. It says similar to a 5.5-year-old, and it's probably closer to a 5-year-old. So by the time she's 20, you would probably be expecting her to function similarly to like a 10 to 12-year-old. And the range comes from the fact that her intellectual ability is lower than her adaptive skills. But her progress will continue to function at about half her chronological age. So by the time she's 30, then she might kind of be falling into the teen years. And so that causes a lot of difficulty, because if you really think of a child with developmental disability who maybe, for example, starts her period when she's 14, you're dealing with a child who has kind of the emotional ability and the thinking and reasoning of a child who is 7. And so things are just much more complex in dealing with. So she will continue to struggle additionally to transfer knowledge from one setting to the other. So if you teach, so the MID child, you might teach with apples, you might teach her with apples, she might not take that information and transfer it over to bananas. So the transfer itself needs to be done. And so when we say we need to teach explicitly, but it's in every individual situation. Because of the complexity, she may have outbursts in class, and she may continue to struggle to learn to express herself and her needs. So this is really to be expected. She will be allowed to stay in school till she's 21, but she likely won't be able to complete the requirements for a high school diploma. That is most likely going to be very difficult for her. We won't stop her from doing it if it happens, but it's not likely. In adulthood, she may have some level of independence, but she'll likely need help for day-to-day tasks. She'll likely be able to take care of her personal needs. So she should be able to wash and brush her hair and clean, but she's not going to learn that the way other kids will. She'll need a lot of training to be able to become independent in that. And that's where her programming at school starts to need to change, because we need to borrow that time to get her to teach those things. So what her parents do at home is likely not going to be enough to make her independent quickly enough. So she'll just need a lot of repetition of that. So sometimes teachers don't understand that you need to borrow from maybe science or history, and it's really and they feel kind of bad about the fact that this child's not getting that, but really what you're doing is you're trying to service them for their future independence. So that school time is really required for that. Okay, so if the school does agree to provide an identification under intellectual developmental disability, this child will have quite a bit of withdrawal to go and work on specific goals in a resource room, possibly. But there's some time where they'll be in a regular classroom. And I just want to state that looking at the research, it's really clear there's no harm that, and I was surprised actually to find this research, because it means someone did the research. No harm comes to typically developing kids, which I didn't think needed to be checked out, but it did. So typically developing kids who are in a classroom with a child with developmental disability are not impacted by the presence of that child. However, the child with developmental disability in the class does make some gains from being exposed to typically developing kids. So I definitely know it's hard work to have kids with developmental disabilities in your class, but you know, work with the resource teacher and they will help you establish something that makes a lot of sense. So I don't know if anyone has ever seen a classroom that works with bins, but I'm a huge proponent for kids with developmental disabilities in developing a system in the classroom and working with bins. So if you have questions about that, I can talk about that near the end, but I just want to get through the general classroom recommendations. So you're going to establish a clear routine and teach that routine to the child. The good news here is you don't need to be creative, because you want that structure, you want it to always be the same, and you require a lot of repetition. So once you come up with a good kind of activity to work on fine motor skills, then you can keep that activity for quite some time. You don't have to keep generating new programs. You're going to program at a modified level, and you're going to modify based on intellectual level so that she can have some success. The best opportunity is definitely a small class setting, but given the reality of Six Nations, all the classes are small. So the child will have the resource withdrawal, but also be in the regular class. You need to isolate concepts. So if you want the child to learn the concept of big, for example, you're going to need to compare a big apple to a small apple, a big banana to a small banana, a big square to a little square. You're going to have to isolate the concept and they're not going to learn that concept incidentally. That's where the bins come in. So if you're working on math with the other kids, and she might be working on the concept of smaller, bigger, or big and small, or the concept of a square or the concept of a circle. And you can put that in like a work bin where she comes and does that and repeats that for quite some time. So repetition, you can do the same work often. So again, the bins. Keep the language simple. Okay, yeah. Use a multisensory approach to learning. Did I mention work bins? So in the work bins, you're going to make sure that they're manipulatives. You might have tokens for counting. You're definitely going to have things that they can construct. There might be adaptive books in there. And so the resource teacher should be able to help guide you in which material to put in your bins and what system to use, so that when they come into class, they're not, what you don't want is to have your child with developmental disability being practicing sitting and watching blankly the teacher as she's teaching something that the child doesn't understand. So that's not a skill we want to just continue practicing. So that's something you're going to have to discuss in terms of how you integrate that in the classroom. And it might be that if you're working on math, then you're doing a math bin. Or any kind of manipulatives. Maybe you're working on fine motor skills. Maybe you're working on how to properly brush your hair or how to place a table. But you're providing authentic tasks because of the lack of transfer. So for example, if you have gym class, after gym class, maybe you have jerseys that need to be put away. Folding clothes is something that is really good motor activity. So Claudette might be a really good person. She might be really pleased to have that job of having to fold while something else is happening in the class. Visual schedules are phenomenal and will be important to help the child know what's coming next. So the visual schedule here is much more simple and related to what you should be doing and where you should be. And so the visual schedule might be like, right now you're doing this math bin. And then when you're done the math bin, I want you to grab this and put it on the done side. And then you're going to move to the next activity. It really helps the child know what's coming next and when they'll get a break. For the behavior, you're going to need to praise good behavior immediately. And so if the child just even if you're trying to shape the behavior of using a schedule, the minute the child just even grabs that information, you're going to, I'm sorry, I'm picturing like a little card, grabs that like little card off the Velcro, you're going to praise that immediately, how amazing that is. And then once the skill is acquired, then you don't need to praise the old acquired skill, but you'll continue to praise new and developing skills. And similarly, you're going to correct poor behavior promptly, but then move on quickly. So if she goes to kind of scream in the classroom, you'll just say like, we don't scream in the classroom, make sure like you shut that down right away and move on quickly, so you don't kind of reinforce that without knowing. Thank you for coming. If you have any questions, feel free to leave a comment below. I'll do my best to answer them. We'll see you next time.